Hi, my name is Katrina NG, and today we're going to be going over insertion of an NG tube. We'll also be going over feeding through an NG tube and also removing the NG tube. So to start, I'm going to verify my orders for placement of the NG tube, and I'm going to gather all my supplies, and I'm going to enter the client's room, and upon entering I'm going to identify myself, and I'm going to ask them for their name and date of birth to verify who they are against my order. And I'm going to explain to them that I'm going to be inserting an NG tube, that it is going to be uncomfortable, but we will get it done as quickly and efficiently and without pain as possible. So first, I'm going to get them up into a high Fowler's position, like he is in. And I'm going to, before I start anything, I'm going to wash my hands, do hand hygiene, and put on some clean gloves. And while explaining to the patient that this is going to be uncomfortable, but I do have an emesis basin here if he needs to throw up, I'm going to drape a towel over his chest in case any kind of emesis or drooling or anything occurs. And then I'm also going to supply a cup with some water in it for him to swallow while I'm inserting the tube. And I got my tape prepared to tape it down. And first I'm going to measure my NG tube to the patient so I can make sure I insert it correctly. So the way we do this is we measure from the nose to the ear and then down to the xiphoid process. Okay, and we would mark that with a piece of tape. And I'm also going to check his nose for patency and see which nair is going to be best to use. And I do that just by occluding one nose and asking him to breathe and figuring out which side. For this purpose, I'm going to use the left nair. And before I insert this tube, I'm going to lubricate it 3 to 4 inches. Okay, and then we'll go ahead and insert it. I'm going to tell the patient to lean back slightly at first while I begin to insert the NG tube. And then as it goes in, I'm going to ask him to put his chin down to his chest as best he can and then swallow the water. So I'm going to hand him that, and I'm going to go ahead and insert. Okay. This mannequin is not being, okay, so now that we got that in place, I'm going to just temporarily tape this in place, and I'm going to check for some residual fluid and check the pH to see if it's acidic, to verify that we are in fact in the stomach. Pull up a small amount of that. Put that on the pH strip, and we're looking for somewhere between 0 and 4, and it was. So that's good, but just to verify, I'm going to go ahead and send him to x-ray. And as he comes back from x-ray, I will put a more secure tape on the tube. Oops, I'm going to knock over my reservoir. Okay, so we're going to put that on and kind of crisscross. And then that will keep the tube on better, attached. Okay, and so now that's inserted, and I'm going to remove my gloves and perform hand hygiene, and then I'm going to document what I did, which was place an NG tube. I'm going to document how the patient tolerated it, and he seemed to tolerate it well. And patients that might need this kind of placement of an NG tube would be somebody who's maybe experiencing malnutrition, someone who is intubated, somebody who's unable to eat or swallow for different reasons. And so that's why we had to place this. Okay, so moving on.